and welcome to day 2 of the SNAP Conference 2021. I want to welcome everyone, and we're so grateful that you're here. First, I'd like to thank SNAP. Would like to thank our corporate sponsors, Roberta Law Firm, Lamuth Law Firm, and MK Safety Net for their generous support. In addition, we'd like to thank our longtime friend, Mitchell Garabedian, for a generous matching offer donation. Prior to our session today, I'd like to take, we'd like to take a moment of silence, if we can, in remembrance of 9/11. If we could all just take a couple of seconds of silence. It is a great privilege for me to be able to introduce our keynote speaker for today. Dr. James Jones was born in Newark, New Jersey, but was raised in Philadelphia, PA. He received his associate's degree from the Community College of Philadelphia, his bachelor's degree from St. Joseph's University. He received his doctorate of medicine degree from Temple University School of Medicine, and he received his training in psychiatry at Temple University. Dr. James Jones is the author of the book, I'm All Right, which documents his transformation from a victim to a survivor of childhood abuse. In his book, he shares his journey in a transparent fashion. He encourages all childhood abuse survivors to step out of the shadow of shame and guilt and stand in their truth. Why is he relevant? Because Dr. Jones experienced what many of us have. It is my pleasure, my distinct pleasure, and an honor to introduce a man that I admire greatly, Dr. James Jones.
Thank you so much, Mike, for that great introduction. I also want to thank SNAP for honoring me with the opportunity to speak about a subject that's so dear to not only my heart, my life experience, but also my practice. The focus on my discussion is post-traumatic stress disorder and the fact that we survivors are victims no more. Next slide, please. One of the things I want to start off with is the understanding about mental illness in general and importance of getting treatment for mental illness. And this slide talks about the impact of untreated mental illness. And the things that individuals who have mental illness may struggle without treatment are the fact that they may resort to drugs and alcohol to cope. Untreated mental illness is going to disrupt social relationships. And unfortunately, because of the behaviors of untreated mental illness, can lead to a high rate of incarceration. Next slide, please. If you get nothing out of this presentation, I want survivors of abuse to understand that you are not a victim, you are an overcomer. You know, your experiences are valuable. At the time, they may not have meaning, but as you go along this road to recovery, you'll find that it's a purpose for your pain. Next slide, please. There are also some truths that you have to understand. Number one, you're not responsible for what happened to you, but you are responsible as to how you deal with it. Shame and guilt will rule your life if you allow it to, and it can definitely interfere with your healing. Sharing your story may be difficult, and at times you may feel as though it's embarrassing, but it takes courage to do that. And as the shame and guilt sometimes becomes a heavy weight that makes it hard for you to move on. But however, what you will learn is through treatment, through support, by sharing your truth, it involves a lot of courage. So those who are able to do so, I applaud you. And also, it's important to seek a community of overcomers who can support you, who understand your struggle, and can partner along with you along this road to recovery. Next slide, please. So, as I said before, I want to talk about post-traumatic stress disorder, but I wanted to be able to lay the foundation as to what post-traumatic stress disorder is. It is exposure to a traumatic event, whether it affects you directly, or you may hear about it, or maybe something that happens over a period of time. Some of the symptoms of that is traumatic nightmares, flashbacks, and feelings of unease and distress. Survivors of PTSD will also avoid situations, conversations, people, and experiences that may trigger those feelings. There's also a change in the way we may think. We have inability to recall certain key events as because those events are too painful. There's also persistent negative beliefs and expectations of the world that we may have. We may feel that the world is an unsafe place. I often use the analogy that the psychic pain that we survivors suffer from is a little bit different than physical pain. With physical pain, you can actually look at a particular body. If I had a broken leg, I can look at my leg. I know that my leg is hurting. I can see it. I can get treatment, and I can heal from it. Pain from untreated trauma is as if your whole body hurts, every organ in your body hurts, every cell of your body hurts, every atom of your body hurts. And that's the weight that we as survivors without treatment have to bear. And that speaks to the degree of that the trauma does to us. There's also an alteration in how we react to our environment. You know, we may become easily irritated. We may become aggressive. We may be hypervigilant because we don't trust our environment. It may cause difficulty in our social relationships, our ability to work. These symptoms can last longer than 30 days. And if there's no treatment, it can cause an interruption in our life pursuits. Next slide, please. A particular category within a post-traumatic stress disorder is not really talked about a lot. It's complex post-traumatic stress disorder. It's written about by Dr. Judith Lewis Herman, her outstanding book, Trauma and Recovery. And what she talks about is there's the PTSD that's caused by an event, whether it's an event of sexual trauma, or you're involved in a horrific car accident, or you're involved in a physical assault. You can reflect back to a particular event, and then the symptoms continue from that. With complex PTSD, it's trauma that occurs over a long period of time, and this trauma is so consistent and pervasive, it becomes what you think is normal. And because it happens in such a long chronic basis. And individuals who may suffer from that are individuals who are involved in domestic violence, you know, people who are prisoners of war, people incarcerated, and people who have been abused sexually over chronic nature, where it's kind of hard to kind of figure out what is right and what is wrong. And you can't really point to an event because everything in your life is traumatic. Next slide, please. Also, even within the whole idea of treating overcomers of trauma is to be aware of cultures, because cultural expression of mental illness is different. And if we don't have a sense of somebody's individual culture, it kind of makes it difficult to get to the heart of what the issues is going on. So as a mental health professional, you have to be aware of our own individual biases to different cultures, whatever prejudices that we may have, to be aware that so we don't bring that into the treatment arena. Also, it's important that mental health professionals have a knowledge of the worldview of the clients that you're treating, and also develop the skills necessary to be able to do a cultural assessment and avoiding particular stereotypical judgments and assumptions. Next slide, please. One of the most important things that I find in treating trauma survivors is engagement. We have to understand that trauma in of itself causes a dynamic of power. Those who are survivors of trauma feel that they are less than, they're not important. As I mentioned earlier, they deal with a lot of shame and guilt and embarrassment, and it's hard for them to speak about it. And it's up to mental health professionals to create an environment where they feel comfortable. And a lot of times, survivors of abuse will feel like they're invisible. What I tend to do in my work with people who are trauma survivors is let them know that I see them and I'm not listening, I'm hearing what they have to say. And they have a say in their treatment, because again, I want to empower them to get the best benefit of treatment that they can. Next slide, please. So Dr. Judith Lewis Herman's outstanding book, she talks about treatment for trauma survivors in 3 stages. Stage 1 is about safety and stabilization. Stage 2 is about remembrance and mourning. And stage 3 is about reconnection and integration. Next slide, please. So in stage 1, establishing safety. As I mentioned earlier, survivors of trauma often feel that they are in a powerless position, and they're used to the world being a chaotic place. And as I mentioned earlier, they deal with a lot of anxiety and stress, and they're disconnected with their body, and the world doesn't feel safe. So before treatment can even begin, you have to establish safety within the therapeutic room, and establish safety that the person can share information with you, that you're not going to be judgmental, and that you're not going to hurt them by allowing them to share the information. I often tell trauma survivors to seek treatment when you are ready. A lot of times people will see trauma survivors and know that they may need treatment, but if they're not willing, and then we as mental health professionals who are deemed as authorities present themselves and say that you need to have treatment, that really is re-traumatizing, because now I'm in an authoritarian position. I'm telling this person what they need to do, and they don't feel comfortable with that. And they may do it because they respect the authority, but I have to be careful that I'm not re-traumatizing them. So we have to make sure that they're safe in the room and they're safe working with me. The next step in safety and stabilization is restoring control. As I mentioned before, it's very important to empower trauma overcomers, to let them know that they're in control of their treatment. We're going to go as fast as you want to go, or as slow as we need to go. It's really about you. Next slide. So in stage 2 is where the work begins. It's about remembering and mourning. So in the first part, that's reconstructing the story. Now, usually when the work with trauma, the trauma survivor will have different elements and different nuggets of memory that are different pieces that need to be put together to a cohesive whole. And again, this is delicate work. We proceed at the rate of the survivor, but it's clear that we have to start with a complete story. The next thing is the transformation of the story. What does the story mean? How did it impact your life? What can we do to help you cope with some of the symptoms of the trauma that you experienced? The other part of it is, and especially is important for childhood trauma survivors who are now adults, to mourn the elements of the lost child, to mourn some things that were lost in the course of the trauma, and to recognize that and respect the loss so that we can work with them to recover. The other part of it is, again, because I talked about how trauma puts survivors in a powerless position, that they don't know how to fight, especially when trauma occurs with children. If you're dealing with adults who are the perpetrator of the trauma, it's hard to fight an adult. So now that you are an adult, you still struggle with the ability to fight, but it's that fight that is going to help with the healing. What I mean by fight is to stand up. What happened to me was wrong. I struggle with that. I need to find out like who I am now that I'm on the road to recovery. And it takes, some encouragement and some careful work with a therapist to help someone to learn how to fight for their right to have some enjoyment with their life. Next slide, please. Stage 3 involves the reconnection integration. How do you make some sense out of what has happened to you in the past? Number one, it's important to be able to reconnect with others. A lot of trauma survivors isolate themselves because they feel that they're the only ones that have gone through what they're going through. As I mentioned before, there's shame and guilt, so you don't really want to talk about it. So you find yourself isolating, not talking to people. But you suffer in silence, which can be potentially harmful. The other part of this section is to look at the reconciliation of oneself. During trauma, there's an issue of dissociation where we become separate from ourselves and from the world, and we get out of touch with our bodies, especially if a lot of the trauma has to do with, if it's sexual or physical trauma where the body's been violated. We want to separate ourselves from our part of our body. So that part was abused, but there's a part of us that wasn't. But we need to reconcile the whole person so that they can get healing. The most important part, and this is the part I was talking about earlier about survivors having the courage to talk about what they've gone through, is to have a survivor's mission. What does that mean? That means, out of all these things that happened to me, what could I do with this? One of the things I talked about earlier is having the courage to share your story. But the better part of it is to reach out to other survivors, encourage them, and encourage them to have a voice as to what happened, so we can reach out and help other survivors seek healing. And in doing so, it leads to the resolution of trauma. That, in addition to treatment, as I mentioned earlier, so that now that you've been made whole, now you can proceed further in your life and not suffer from things that have happened in the past, but work on trying to get some meaning as to what that has had, what impact it's had in your life, and what you could do with the rest of your life as you move forward. Next slide, please. Now, one of the methods of treating PTSD is medications. Now, I will say right from the onset that treatment, PTSD can be cured. It doesn't require medications in the long term. It may require medication in the short term, but I want to be clear that medications are something that may happen in the beginning of treatment, but as the individual is working on a trauma, finding the supports and able to find their own voice in the trauma, medications may not necessarily be necessary for the long term. Some methods of treatment for PTSD are prolonged exposure, which I'll get into, as well as EMDR, and then alternative treatments. Next slide, please. Three of the most common medications that I use to treat PTSD are prazosin, which is a blood pressure type of medication, but it's very effective with nightmares and flashbacks that a lot of individuals with PTSD suffer from. The other medication, which again, it could be potentially hazardous, is a benzodiazepine, Xanax, Valium, Klonopin, which I don't particularly prescribe, but it can be prescribed in some cases. And the reason why I don't, because it has an addiction potential. If you are taking these medications for greater than 2 weeks, you could become tolerant, which means you need more of the medication to achieve the same effect. And that could lead to addiction and become problematic in individuals with any condition, but especially people who are trauma survivors. Another medication is Paxil, which is an antidepressant, but it has been found to help with individuals who have PTSD, to help not only with depression and anxiety that's associated with PTSD, but the nightmares and flashbacks as well. Next slide, please. So now, prolonged exposure. That's a type of treatment where a trained therapist is working with a trauma survivor, and they're actually going through some of the memories, again, in a slow pace, as fast as the individual can tolerate it, or slow if they cannot tolerate it, because these feelings can be overwhelming, especially if they've been suppressed for a number of years and they're percolating up and they're really kind of dealing with it. It could be overwhelming. So the trained therapist has to be very careful as to how they proceed. but it requires the individuals to be able to talk about it, to allow themselves to expose themselves to the feelings and recall the memories. And it can be effective, but again, as I mentioned previously, it takes some work and you really follow the speed of the survivor. Next slide, please. One interesting mode of treatment is EMDR, which is eye movement desensitization and reprocessing, which was discovered by a psychologist, Dr. Francine Shapiro, in 1988. And what it does is it allows the individual during the course of treatment to actually experience the trauma during a therapeutic session. And the way that it happens is a trained therapist, and what I mean by trained therapist is actually EMDR training that a therapist will go through and become certified, or learn the instruments that are used for EMDR. And it can be done in two ways. It's an issue of trying to uncouple the way the right side and left side of the brain works by using lights or tones to help a person float back and to kind of think about some of the traumatic events. Now, one of the interesting things that Dr. Shapiro noted is that unlike many modes of treatment, like medications and prolonged exposure, they require that the individual actually wants these things to work. For some individuals who may be ambivalent about treatment, EMDR still works because it really works at uncoupling the way the brain is functioning. Now, one of the important aspects of EMDR is what it really talks about is a lot of trauma survivors who've actually had treatment at the time of their trauma, many of them won't develop PTSD. It's the individuals who've had a traumatic experience and the treatment goes untreated that they develop the PTSD. So what EMDR does is almost like you float back into the time that this issue had occurred, and you're processing it. It appears that you're processing it in real time, so that helps you deal with the trauma, and it has been shown to be effective in many individuals. Next slide. It is another book that I think is very helpful. It's written by Dr. Besse called The Body Keeps the Score, which is interesting because it looks at a lot of some different methods of treating PTSD. Dr. Kolk runs a center in which he utilizes various non-traditional ways of treating post-traumatic stress disorder. What he looks at is diet. A lot of times we, as people in general, especially as Americans, we don't really eat have the healthiest diet. We eat a lot of processed food, maybe more meat than we should eat, and that has an impact on our whole mental health, and it really has an impact on trauma survivors. And related to that is exercise. We also don't get enough exercise. So physical activity is very helpful, increases the endorphins, which is a positive hormone that the body makes naturally, which also can lift our spirit and also helps us to deal with the aftermath of the trauma. What I found interesting is Dr. Kolk talked about massage. Now, when you think about it in general, what does massage have to do with PTSD? But remember, as I mentioned earlier, a lot of trauma survivors become disassociated, separated from their body. And massage therapy, and that's just regular massages, it can help you reconnect to your body. Now, that could be something that, again, has to be taken on a case-by-case basis, because individuals who are survivors of sexual trauma may not be ready to have someone place their hands on their body, and it's certain that could be understood. But as they progress in therapy, that might be something that might be helpful. The other thing that I found was interesting was theater. And what Dr. Kolk talks about is in his center, they have dance, they have singing, and they have acting. Now, what he said was very interesting. We're not talking about people who actually have the ability to sing, dance, or act, because certainly I know that I don't. But one of the things that he found necessary is it still puts you in connection with your body. The mere fact that you can stand in front of people and sing a song, whether it's off key or whatever, it's the fact that you have the courage to do that connects you with the audience, connects you with your body. The fact that you can dance by moving in space also helps to connect you with your body. And even acting, being able to think about emotions or express emotions is very helpful. And I found, very, again, non-traditional, but it certainly makes sense. Next slide, please. So there's this whole idea about recovery transformation, which we talk about it in general in mental health treatment, but it's really particularly important for trauma survivors. And at the core of the issue is for mental health professionals to partner with the individuals that they treat. I know as a physician, I could come up with a wonderful treatment plan that if I was to speak to a room of psychiatrists, psychologists, and other mental health professionals, we'd all agree it's outstanding, it should work, and it makes perfect sense. But if the individual in front of me is not buying into it, I really haven't done my job. So I really have to be able to communicate with the person in front of me so that they understand that this might help, or if they have suggestions that I didn't think about, that I have to be open to those suggestions. And again, my opinion as a mental health professional is important, but it's much more important that I engage the person in front of me. And the other thing that I find that individuals, once they give options, it really kind of makes a world of difference. When I talk to someone and we'll talk about them and I say, this is what I think, what do you think? Usually individuals would defer to me as the doctor, the one with the clinical experience, the one that should know what they should do. But they're not really used to being in a position of being able to make the decisions for themselves. And again, as I talk about the dynamic with trauma survivors, where they feel powerless and they defer to an authority, it changes the whole dynamic. You often get the phrase from people, "Oh, I can make a decision. Oh, it's okay if I say no." Absolutely. Let's work together, because when you work together with someone and they can see that they have a say in their treatment, you have a much greater chance of success rather than me developing a plan that I think is great and they're just going along with it. Again, because that gets to the whole issue of me re-traumatizing somebody by not allowing them to express their opinion. Next slide, please. So in a greater sense, it's important about having a whole conversation about talking about mental illness in general. Trauma survivors, are coping with their mental health issues, but they face a world where there's no open discussion, or there's a lack of open discussion about mental illness. People will put mental illness in a particular box that they wouldn't put high blood pressure or diabetes. But both of these are conditions that require treatment. And there's no stigma with high blood pressure and diabetes, but there is a stigma with mental illness. And that's one of the reasons why I encourage survivors to be able to stand and speak to their own truth, because by doing so, it helps remove the stigma of mental illness. And when that happens, you find that you can have support, and there's much more of an open dialogue about those particular issues. Next slide, please. So now I would like to talk about some resources that are important for survivors of trauma. There's family, there's religious institutions, community mental health centers, and also the government to be able to fund services for underserved communities. Next slide, please. Family can be an important source of support for individuals. We have to bear in mind that some people come from environments where the families may have been a perpetrator of the abuse. So, again, you got to look at each situation on a case-by-case basis. But even within a family, there are still individuals in the family that are supportive, and I'm speaking to those individuals. A lot of times families don't know what to do. Sometimes families don't know what to say. They think somebody can pull themselves out of it, or if they're a trauma survivor, that happened 10 years ago, 20 years ago, you should be past that. They don't have a sensitivity to how trauma can impact someone's life on the long term. So there's agencies like the National Alliance of Mental Illness, NAMI, which can help to educate families so they can better support their family members with mental health issues. Next slide, please. Now, religious institutions. Now, in general, part of the work that I know that SNAP does is to deal with sexual trauma survivors that the abuse occur within the church. So I understand that's a delicate and sensitive issue. But I think it's important to realize that there have been individuals with any church, and no particular church is immune to this. All religious institutions will have this as an issue, but it's the individuals who perpetrated the abuse that should be held responsible, and not the church in general or religion as a whole. Um, in those institutions, religious institutions where they are open to the discussion of mental illness in general, the trauma in particular, it's important that they partner with mental health professionals. While I confess to know a great deal about mental illness, I'm not a religious, I have not been trained in religion, I'm not a religious expert, so I defer to the leaders of various religious institutions to guide me, to help me. But it's very important to partner with me so that we can get the best help for people who are seeking treatment. Next slide. It's also important in some cases for the government to be involved. Again, in a lot of underserved communities or individuals who may not have the financial resources to pay for mental illness, it's important that they have the opportunity still to get mental illness, especially in the case of trauma. Trauma really it becomes a real issue in individuals who don't have access to treatment, and we have to make sure that they have access to treatment, and the government certainly can play a role in that. Next slide, please. So when I have the honor to treat someone who is a trauma survivor, who has the courage to share their story with me, I have to emphasize, I can't emphasize it strong enough that they are very important. They're the most important person in this process. And I have to communicate the fact that we have to work together for them to get the treatment that they deserve. But it's really about empowering them and encouraging them along the process. Next slide. So some of the resources that I've used for the story to this discussion I think is very important is the two books I mentioned, The Trauma Recovery by Dr. Judith Lewis Herman, The Body Keeps the Score by Dr. Besse Kolk, DSM-5, which is the manual that we use for mental illness that describes various mental illnesses. And a book that I didn't talk about during the course of the discussion, but it speaks to the mental health in the African American community, the Protest Psychosis by Dr. Jonathan Metzl. Next slide, please. So how did I get to the point where trauma has been important? As Mike mentioned in introductory, I am a trauma survivor. I think because I'm a trauma survivor, that led me into the field of psychiatry, because I kind of understood what it's like to, number one, suffer in silence from mental illness, to deal with shame and guilt, and to feel less than. And I wanted to be able to understand how I can can help other people who suffer from the same thing. Now, one of the things about trauma and its insidious nature is different people have ways of coping with trauma. I mentioned earlier with untreated mental illness, individuals can suffer from substance abuse, bad social relationships, and occupational issues. One aspect of it is individuals who are trauma survivors who have some degree of intelligence may become overworkers and hard workers and overachievers. And I think that's, looking back on it, that's how I cope with my trauma. I've always done well in school, did well in college, was able to get to medical school. And I tended to minimize my trauma because I am a survivor of physical and emotional abuse, but I'm not a survivor of sexual abuse. And I tended to say, well, my trauma is not that bad because that didn't happen to me. During the course of my journey, during the course of my reading, what I found out is everything is relative. Everybody's trauma to them is the worst thing that's ever happened to them. And the trauma itself can have a devastating impact in their life. And I think when we tend to minimize our trauma, we do ourselves a disservice. And I did that through the vast majority of my life. So even though I had some measure of success, my untreated trauma did have a negative impact on my life in regards to my relationships, my finances, things of that nature. And as I went through my road to healing, which didn't happen until I was in my 50s, I realized, looking back after getting healing, the impact that my traumas had throughout the course of my life that I was blind to, that I minimized. So that led me to write my book, I'm All Right. Now, I picked the title of the book, I'm All Right, because it's a phrase I commonly use. And if you think about it, the phrase I'm all right is a verbal response to the question, how are you doing? And we tend to say, I'm all right. And if you really think about it, at its core, I'm all right means nothing. I've told you nothing. It's, and a lot of times for myself in particular, I didn't want to tell the person that I feel less than, I feel, like I'm a failure, despite what my appearances may be. I didn't want to tell them that I suffer from depression and low self-esteem. I just wanted to say, I'm all right, so I wouldn't burden them with my issues. And the fact of the matter is, many people who ask the questions, they really didn't care anyway. They just wanted to have something nice to say. But what I missed in this whole journey was I didn't take advantage of the opportunity of several people throughout my lives who would have been able to help me if only I was able to share my story. But again, as I said before, a survivor of trauma can only share the story when they're ready. So I take solace in the fact that I wasn't ready, but when I was ready, having the courage to stand in my truth was very helpful. When I wrote this book, I talked to many individuals about me writing a book. And while I'm used to the individuals that I might treat during my work in the criminal justice center to incarcerate individuals, through my work in various psychiatric hospitals, and during my work in various substance abuse programs, I'm used to those individuals telling their trauma story. But what I learned by sharing my trauma stories, individuals such as myself, who are professionals and for all intents and purposes look to be successful, began to share this story with me only because I had the courage to share my story with them first. And I remember before I published the book, I had a colleague of mine say something that was very interesting. It gave me a moment of pause. And what she said was, Dr. Jones, do you really want to write this book? Do you want to write this book where you're telling all your dark secrets, or you're letting people know about your skeletons? Because people may judge you. And what I understood at that moment was that my book is not for those who will judge me. My book is for those who are like me, who are suffering, who need to find their voice. So while it is a risk that people may judge me, that's not my audience. My audience was and still is for trauma survivors to find their voice and to stand in their truth. Next slide. I want to take this opportunity to thank you all for listening. I want to thank SNAP for giving me this outstanding opportunity to talk about trauma, and also to encourage the trauma survivors. Stand in your truth. You're more powerful than you think you are, and your life experiences have meaning. And with time, that meaning will be revealed to you. Revealed to you. Thank you so very much.
Thank you, Doc, very much for a wonderful presentation. And, you really hit on so many keynotes that many of us need to hear. We may have heard them before in some way, shape, or form, but to have that reinforced today was so important. We have a few questions for you, Doc, and I'll go through them. First question that we have is number one, thank you for the presentation. And the question is coming from, I just have to scroll up here, from Paige. I'm wondering if you could extrapolate more on the definition of overcomer. At what point are we overcomers?
That's a very good question. The moment that you have the courage to speak about your experiences is when you are the overcomer. It's not, after you've had a certain amount of treatment and all, no, because a lot of us trauma survivors, we suffer in silence and we deal with it by ourselves. But the moment we can speak that out loud, that's when we become an overcomer. That's when we don't allow the trauma to overpower us, but we overpower it and we overcome the things that we've experienced.
It's so interesting you said that too, Doc, because I noted that when you talked about the road to healing, how you began, you were in your 50s, and we hear so many times our statistic as survivors of childhood sex abuse that the average age for individuals to disclose is age 52. So I found that very interesting when you mentioned that. The next question is from Bobby. How can activism be a part of our healing journey? Can the cooperative pursuit of justice help us quell negative feelings related to injustice? Is activism a path to us recovering our power?
Certainly it is. And there's many avenues to that. There's some people who have the gift of activism. And so, yes, because you have to speak truth to power. Certainly, you have to be able to advocate for services, and certainly you have to be able to advocate for if there needs to be compensation for those survivors. Someone has to have that journey, and it's better to have someone that's experienced to be the activist than somebody that doesn't have that experience. However, everyone can't be an activist. And again, it's about finding your own particular voice. You know, whether some people could be activists, some people may decide to go into the profession and help individuals on a one-on-one basis. There's many avenues to debate. Activism definitely is a part because it's about opening up the discussion. I think that's what activism does. So I do think it's a vital component.
Our next question, Doc, comes from Becky. I found the grieving stage the hardest to get through. I keep revisiting that stage. What suggestions do you have for getting beyond this stage?
Well, I think what's important is, number one, to be true to yourself. And a lot of times we have to resist the thought process of trying to get past it. You know what I mean? The whole life in of itself is really a journey and it's a process. So that's why I talk about, number one, I think it's important to have treatment with a mental health professional, but also I mentioned it's important to have that support group, right? Because you could talk to your therapist, and unless your therapist has had that experience, and they may or may not share that in therapy, various therapists have different opinions on that. But if you're in a support group where people have similar experiences, they can kind of help you go have a conversation about it. So really it's more about being able to express your grief and not have anybody tell you should already be over that, but just to be honest about how you feeling, but just have that support system where you always are free to talk about it. I think that's much more helpful than looking at some date in the calendar to say when I'll be over it. It's really about just expressing it, really. I think that's more important.
Thank you for that. And I have one question. You didn't think I was going to let you off the hook without me asking a question there. So during your presentation, and it's something that us as survivors have experienced many times, and we talk about the religious institution and seeking mental health, and somehow there's a merge there. Often, as is the experience of many of us, there's that underlying concrete, you're never going to change, distrust with the institution itself. You know, I really liked, and I wanted to highlight the fact that seeking mental health or therapy outside of the religious institution is best. And I'm not knocking certainly your suggestion there with religious institutions. I think, would you, and my question is, do you feel that that is something that should be discussed with a therapist?
I'm sorry, when you say discuss with a therapist, like even more specific.
Well, if an individual feels that they want to pursue some type of therapeutic spiritual therapy through the religious institution, whatever that institution may be, do you think it would be wise for the individual to discuss that first with someone who is a third party?
Well, I think I think it's very important that people stay within their strength. So I think that number one about the whole issue about sexual trauma that may have happened within the church system, I think it's important to, as I mentioned during my talk, to separate the perpetrators, the persons that have done it, from the whole religious institution, because I think it's almost unfair to use a broad brush to look at the whole religious institution based on the behaviors of some people. That's one thing. But it's also really, I think what's happened in the past is a lot of religious institutions will tell people to pray and read the Bible or the Torah or the Quran or whatever. And that was a way of dealing with it. And that's not fair. So I think it's important that mental health professionals provide the treatment. I think for some individuals, their religious experience can also help with the healing. It is going to be difficult. I have to be honest. Individuals who have dealt with trauma in the church, they review the church differently, and that really that is the issue, and we can't ignore that. So to answer your question directly, I think it's much more important that the mental health professionals help individuals who are trauma survivors apart from the church. It's just that the church in of itself, if it's not open to the discussion, it can kind of lead people not to get treatment and to deal with things with prayer and reading religious texts, which could be helpful, but it's not going to be curative for the trauma.
Well, I can't thank you enough, Doc, on behalf of SNAP for your willingness to be with us today, and a wonderful presentation. And I really love, and I'll leave it with this, I love how you talked about the survivors, victims being the most important person, and that puts them in the driver's seat. Correct. And I think that is such a key part to each and every one's journey. So I thank you very much again for being with us today. And folks, for time purposes, we'll be able to, if there's no further questions, we're going to be taking a break here until our next session. So again, thank you, Dr. Jones, very much.
Thank you for the invitation. You're quite welcome.